So right now, some of the factors that we are finding to be most relevant are, on the one hand, the extramedullary disease, which I mentioned before. For some reason, the CAR T cells are not able to overcome this factor, especially when the volume of this extramedullary disease is high. And this appears to have a lot of relationship with another factor, which is tumor burden. High tumor burdens are very difficult for CAR T cells to manage. We find that the best results are in the patients that have the lowest tumor burden when receiving the treatment. We have to remember that the number of CAR T cells we put in the patient is limited. They will expand to some degree, but they have a limited time inside of the patient. So it will be much easier for them to fight 100 than to fight 10,000, for putting an example. And those are perhaps the two most relevant, because other factors such as high-risk cytogenetics don't appear to impact that much, which does have a big impact on other settings of the disease. And another good factor could be the revised international staging system. Patients with RISS3 who tend to go worse. This is interesting because when you only analyze high-risk cytogenetics, there is not that much of an impact. But when you use RISS, there is. So perhaps using this classification would be much more useful.